20 years ago, this knowledge saved her life. Now she's on a mission to help others make the herbal connection. In this series, she discusses common conditions and ways to help others live well.
Hi, I'm Dr. Beverly Nicholson. This is the Make the Herbal Connection. And what we do here on this show, we educate and inform, and we talk about different topics. This week we're going to talk about women's health issues. So basically we're going to try to cover a lot of different issues that affect women. First thing we're going to talk about is fibroid tumors. Talk about fibroid tumors because so many women have fibroid tumors, and so many women have had fibroid tumors removed, and they always come back. So people always ask me, well, Dr. Nicholson, what does a fibroid come from? The best analogy I like to give is you weren't born with it, so where did it come from? Fibroid tumor is not something that you were born with. A lot of times it comes from the fact that we've been constipated all of our lives. And when we're constipated all of our lives, the accumulation of waste that's in the body sits in the body. That's why they tell the story about John Wayne. When he died, they found out he had about 44 pounds of undigested food left sitting in his colon. So when a woman has a fibroid tumor, basically, a woman's body becomes anemic. Her body becomes weaker and weaker, and the fibroid tumor gets bigger and stronger. It starts off the size of a pin, then it'll get the size of a lemon, then it's the size of an orange, then it's the size of a grapefruit, then it starts going into sizes of fetuses. Why is it getting so big? What is it feeding off of? A lot of doctors like to use the estrogen theory. I believe that the fibroids are growing because they're living off of the undigested waste that's sitting in the colon. So that's why they get bigger and bigger. So in my 20 years of working with women and female issues, the way I shrink tumors is you cleanse the colon. I use ET. ET is an herb that's been around since the 1800s. It's used to shrink tumors. It's very good for shrinking fibroid tumors. I use a product called FC with Dong Quai. FC stands for female corrective. Dong Quai is a Chinese female herb. And then red raspberry. I call red raspberry a DNC in a bottle. Now, what the role that red raspberry plays in shrinking fibroid tumors is if a woman, red raspberry is known as a pregnancy herb. If a woman is pregnant and she takes red raspberry, it gives the baby a clean environment to live in. Now, if a woman isn't pregnant and she takes red raspberry, it cleanses the environment out. So I call red raspberry a DNC in a bottle because it cleanses the entire environment out. So when we cleanse the environment out when a woman has fibroid tumors, it helps to shrink the fibroids. Now, when we shrink the fibroids, where is the waste from the fibroid going to go? Where's all of this morbid matter, all of this morbid material coming from the fibroid? Where is it going to go? So we use a colon cleanse. We use a colon cleanse because when you use a colon cleanse, when you shrink the fibroid, the waste from the fibroid, you can cleanse it out of the body by doing a colon cleanse, having 3 to 4 or 5 or 6 eliminations a day. That's how you shrink the fibroid. Then we start with endometriosis. A lot of women have endometriosis because the lining of the uterus just gets so thick. And I think it just gets so thick with a lot of waste. So going back to the female correctives, going back to Dong Quai, going back to red raspberry, there's a lot of different female corrective herbs that we can use when we want to clear up fibroid tumors and we want to clear up endometriosis. In my 20 years of working with women with female problems, with female disorders, it's all coming back to the fact that it's just filth that's in there. I try to tell women, we should start trying to let our vagina be as clean as our mouths. There's so much controversy about douches, and I think the worst thing I'd ever heard was the fact that women should not douche. Well, going back to you've got 5 senses, but we also have a 6th sense, which is common sense. Now, common sense will tell us that if every month you have a period, and when your menstrual is over every month, all of the waste that your body has given off during that time, if you've got some kind of a discharge, common sense would say that you need to use some type of a douche. Now, then when a woman gets to the point after she has sex and semen is ejaculated into a woman's body, and sometimes, maybe the man's prostate might not be functioning properly. Maybe the man might even have prostate cancer. Maybe just the odor that's coming from that prostate is ejaculated into a woman's body. Now, common sense should tell you that you need to use a douche. Now, if you have a vaginal discharge, if you've got candida, if you've got yeast, if you're having a vaginal discharge like thick as some type of a cottage cheese, or you've got some of a type of a cottage cheese douche, as opposed to using so much monostat, that sixth sense, common sense, should tell you that you need to do some type of a douche. Now, there's so much controversy about douches, and I'm kind of I can understand maybe what they're talking about when they talk about what to douche with, but they don't know, medical doctors don't know that you can use herbs to douche. And some of the best herbal douches in the world are using chlorophyll. The same chlorophyll that I use in the colon cleanse, I use that in the herbal douche as a base. You can use chlorophyll. You can get an old-fashioned douche bag to douche the water / enema bag, and you use distilled water. And in that old-fashioned douche bag, you put like a gallon of water in there. You put about 4 ounces of chlorophyll and open up about 4 capsules of red raspberry. Anything that you can drink, you can douche with it. You can drink red raspberry tea. You can drink garlic tea. You can drink acidophilus. You can drink golden seal. You can drink dung quai. Any of these different herbs that you can drink, when you make a tea out of them, but basically you can do the same thing, but instead of making a tea, you're going to make an herbal douche. And that is one of the best douches in the world, to use it with a base of chlorophyll. Now, chlorophyll, why do we use chlorophyll? Chlorophyll deodorizes the entire intestinal system. You know, there was a joke out years ago, and I never thought the joke was funny, but the joke went something like, when the blind man passed by the fish store, he said, "Good afternoon, ladies." I never thought that joke was funny. I never thought it was funny, but that's just, I guess it was some type of, I won't say tradition, but it's just been a fact that a woman's body did not have, the perfect, it was based on not the perfect environment. So that's why I've always thought that when medical doctors tell women that you should not douche, that right there, going back to that sixth sense, common sense would tell you that if you don't keep the environment clean, guess what's going to happen? So then we've got ovarian cancer, we've got cancer of the uterus, we've got cancer of the cervix, we've got cancer of all of these different organs that are located inside your reproductive organs because of the fact that medical doctors are telling women don't douche. I had a lady to come into my office. She was 56 years old, and when 56 years old, she had a very large stomach. And the first thing I asked her, I said, "Well, what do you douche with?" And when I said, "What do you douche with?" she was taken aback. She said, "Douche? Oh no, I don't douche. My doctor told me I don't douche." I asked her, I said, "Do you have children?" She's like, "Yes, I have 3 children." I say, "And you're 56 years old and you've never douched?" And she's like, "Oh no." And I felt sorry for the lady, so I had to tell her, well, it's no wonder you have ovarian cancer if you've never cleaned it out. So it's just going back to common sense. If we never clean our organs out, if cancer comes in, it's no need of saying, "Oh God, why me?" Because you should have had enough sense to keep your ovaries clean, to keep your cervix clean, to keep your uterus clean. And another thing that women do, women have surgery and they have a partial hysterectomy or they have hysterectomy, and after they have that hysterectomy, they never think anything else about that area again. It's just like if you see a vacant lot, if you see a building and that building is standing there, 2 or 3 weeks later you go back and the building is no longer there, it's a vacant lot. Now you'll go back in another month or so and you'll see nothing but weeds growing up there. So it's the same principle involved in the body. If in the body you've had an organ removed, if you don't give that area some tender loving care, just like the organ was still there, it's just like if you get a tooth pulled. If you get a tooth pulled, if you don't replace it with another tooth, that tooth is going to move over in that area. So it's the same principle involved in the body. When women have organs moved, they never go back and think about that they should douche or they should take any black cohosh or natural estrogen. When women's getting ready to go into menopause, we need to take black cohosh. I'm 51 years old. I've never flashed, never had a flash, never will flash. Because I found out years ago to take black cohosh, which is a natural female estrogen. We've got so many women now, we've got so many baby boomers that take Premarin. Premarin is the urine from a pregnant mare. That's where the source of Premarin comes from. Ask your doctor. Ask your medical doctor where Premarin comes from. It's the urine from a pregnant mare. Now, they tell us that we need to take Premarin, because if we don't take Premarin, that we will have breast cancer and osteoporosis. Now, if the truth be told, Premarin gives us breast cancer and osteoporosis. But like I said, when you learn better, you can definitely do better. So as opposed to taking Premarin, we need to learn how to get into black cohosh. Black cohosh is a natural female estrogen. A natural estrogen, not an estrogen replacement therapy, not a hormone replacement therapy, but a natural estrogen. And that's what we as baby boomers need to get into for menopause. Another thing that's good for menopause, and I do a lot of research on menopause because I do a lot of for women only seminars. The more you cleanse the body, what is PMS? What is toxemia? What are hot flashes? Toxemia is coming from, keyword that when a woman is pregnant and she has toxemia, keyword there's toxins. PMS, when a woman has premenstrual syndrome, that means there's so many poisons that they back up into the bloodstream. Then a hot flash. What is a hot flash? Toxins. If you cleanse the body and you get rid of all of the toxins and the poisons and the chemicals and all of the environmental toxins that are going on in the body, then you would not have to worry about hot flashes. When we go into menopause, menopause is a time in our life that we should all thank God that we made it to that age and look forward to it and be able to go through it gracefully and not sit up and have to have your own private summers and be on all of this estrogen replacement therapy and the hormone replacement therapy. Get you black cohosh, which is a natural estrogen. Also use flaxseed oil, evening primrose oil, vitamin E. There's a lot of different herbs that we could take for hot flashes. Wild yam is another one that comes to mind. The FC with done quiet is another one that comes to mind. There's a lot of good things that we could take, going back to learning how to cleanse the colon, learning how to use herbal douches. And that herbal douche is nothing but, like I said, chlorophyll with distilled water, and you open up herbal capsules. You open up capsules of herbs and make an herbal douche, and you use it.
So with cancers in the cervix, the ovary, and all through the uterine and all of that, what kinds of things do they need to help support that?
To help to support that by cleansing those areas out, by using the douches. I also use vaginal suppositories. Sometimes when I have women, if they have real bad discharges, I'll make vaginal suppositories, and we'll use a suppository one night, and the next morning, upon awakening, then they would use an herbal douche to cleanse out the residue of the vaginal suppository, and just giving nutritional support to it. Be good to the vagina can be good to you.
So it's a weak area because you have to go through all the menses, or it's a weak area because...
It's a weak area because it sits so close to the colon. That's why sometimes women that have never had children are prime candidates and prime suspects for having these different things. And sometimes it's endometriosis. It's sometimes called a disease for women that wait till later in life. A lot of times when women are career women, they wait till later in life to have babies. So that's why they say a lot of times endometriosis is able to set in it. But it's just coming from the fact that the area needs to be kept clean. We don't wear, a lot of times we don't wear white underwear. We wear colored underwear, the different dyes and the colorings from that. And bacteria loves to live in a nice moist place. So we have so much bacteria that grows. We have so much candida and yeast, so much fungus, so much, that just grows in the body.
What's that about?
Fungus is a precursor to cancer. Fungus, yeast is candida. And when we continue to eat dairy products, we feed candida off by eating so many dairy products. So it's about just bacteria, antiviral, antibacterial, antifungus, just different bacteria that just live in the body.
Because, they selling this Monistat like it's Pop-Tarts.
Oh, Monistat, they're a booming business. They do the suppositories. They've got the cream. They've got the this. And as many times the doctors write prescriptions for Monistat, if they would just tell a woman, go home and take you an herbal douche. Get you some FC with done quiet and keep your female organs. Give some nutritional support to the female organs as opposed to always just taking an antibiotic. What happens when we take an antibiotic? Antibiotic takes all of the friendly bacteria out of the entire intestinal system. So if a woman has a yeast infection and she goes to the doctor and she gets an antibiotic for the yeast infection, well, guess what happens? The antibiotic gives her another yeast infection. Then it becomes a vicious cycle. Then she'll develop an itch. Then she'll develop a discharge. So then she's steady taking more monostat. Now think about this. You're getting all of these vaginal discharges, all of this itching, but yet still your doctor is saying, don't douche. That's a scary thought. That is really a scary thought, to be having all type of vaginal discharges. And even with using the monostat, if you use a monostat suppositor, going back to that sixth sense, wouldn't your common sense tell you, even if you're going to use a monostat suppositor, that you would need to use a douche to cleanse out the residue of that suppositor? Now that to me is just common sense.
So what are some dietary things that would be considered in trying to support female reproductive system?
Staying away from a lot of dairy products. If women would stay away from dairy products, they would not get endometriosis, they wouldn't get fibroid tumors, they wouldn't get breast cancer. See, when we talk about red meat, when we say don't eat red meat, the red meat is bad for us. But if we continue to eat the milk, if we continue to drink the milk, where's the milk coming from? From the same cow that we said don't eat the meat. But if we continue to do the dairy products, we've got the BGH, the bovine growth hormone, that they inject into the cows. The steroids, the hormones, the antibiotics, all of the chemicals, all of the different things that they inject into it. So when we as women use these, we eat these different products, this is getting ingested into our bodies and it's affecting our female organs.
There's, I was reading an article and it had the headline that more people are dying of infectious diseases because of overuse of antibiotics.
And that's a scary thought too, because they use antibiotics for everything. And so many people tell me, well, Dr. Nicholson, if I do a colon cleanse, it's going to take out all of my friendly bacteria. We don't have any friendly bacteria, because from years of us taking different antibiotics, all of the friendly bacteria is gone. And all you have to do is stop and think, how does it smell when you have a bowel movement? Does it smell friendly? So therefore, we don't have to worry about that, but there's an antibiotic, amoxicillin, erythromycin, tetracycline. Tetracycline is so potent that if a mother takes it while she's pregnant, the baby's teeth will come in yellow. But these are antibiotics that we take. So many antibiotics, you know, and we've got a antibiotic for this, we've got an antibiotic for that, and they're finding now that the antibiotics are not working. They have basically played out. They are not working. So we need to learn how to get some golden seal, olive leaf. Olive leaf is a great antibacterial, it's an antifungal, it's antiparasitic. Olive leaf is a very good natural antibiotic to use. And then we've got echinacea. We've got golden seal. We've got vitamin C. We've got a lot of great, you know, same thing with flu shots. I tell people golden seal and echinacea is a flu shot in a bottle. As opposed to going and getting a flu shot, get you some golden seal and echinacea for a flu shot. And that helps to work as a natural antibiotic, but it also helps to increase your immune system.
Now, what do you think about the effects of birth control pills on the female reproductive system?
Basically, what birth control pills do, there's a lot of side effects. Because sometimes, basically, it's just like when women get that shot, it's really against the grain. It's really not what God intended. So sometimes women have a lot of bad side effects. They have a lot of blood clotting and a lot of phlebitis when they use different birth control pills.
Right. I mean, the oral ones, too.
Yes, the oral ones, too. The oral ones, too.
Because I've noticed that they've been given that shot and women gain so much weight.
Not only do they gain weight, the average woman, when she gets that, what is it called, Depo-Provera, when she gets that shot, notice the skin. Now, from the time we're born until we go into menopause, we've got a certain amount of eggs. And every month, unless you're pregnant, that egg is released. So if you're of childbearing age and that egg is released and you've taken a Depo-Provera shot and your period does not come down, where is all of the waste going? So all of the waste basically is backing up into the body. And always remember, we reflect on the outside what's going on the inside. The skin is an eliminating organ, and the poisons and toxins come to the surface because they're trying to get out of the body. So if we take a shot to stop our period and the egg is still being released, where are all this body waste going? So it's totally against Mother Nature.
Well, in the commercials they promote it as if the pill regulates the menstrual system.
Yes.
And it clears up skin.
Yes.
So what's the difference between them?
Well, the difference with that is just like what they tell us about surgery, chemotherapy, and radiation. It does. They tell us traditionally since 1950, 3 methods have been used, and we know that they don't work. So when you're selling a product, and that's all it is about, is selling a product. It's not about helping us. It's all about the almighty dollar, because if it was about helping us, then FDA would let them tell people to start using red raspberry, to start using FC with done quiet. And then even if women want to get into birth control, I'm not advocating telling women to go do it, but there's an herb called wild yam that can be used for birth control. But it's all about where you have the faith. So we want to do things that are totally against Mother Nature, that's totally against the grain, and then that's why we've got the weight gain, we've got the bad skin. And then when a woman, when the shot wears off and the period comes back, it comes back with a vengeance. It comes back with a vengeance because it's been suppressed for 6 months or a year, or however long the shot lasts. It's been suppressed. So when it comes back with a vengeance.
So it's just so much engineering going on with the female reproductive system.
Yes.
You have to just kind of streamline all of it.
You have to kind of streamline, but it's all going back to you are what you eat, but you are also what you keep. Because the reason I'm saying that, we've got young girls now, 5 and 6 years old, little girls, that are using deodorant. Now, breast cancer awareness lets us know that the breast cancer is on the rise. Now, if we've got little girls 5 and 6 years old that are using deodorant already, their pores are getting clogged earlier and earlier. So the number for breast cancer is not going to be reduced if we can't get to the masses of women and start trying to educate them about using the different deodorants, changing the diet so that the children won't have to use deodorants, and drinking good water and incorporate cleansing into the body. Because if we don't learn to cleanse our bodies, breast cancer is going to continue to take us away. It's all going back to the filth. And this filth in the body, it can be in the breast, it can be in the ovaries, it can be in the lymphatic system. But key word there, cancer is just filth that's accumulated in the body.
One last thing, what about
tampons? Tampons, toxic shock syndrome. This was a thing that they had some years ago about tampons, and if you stop and think about it, maybe they are good to a point, but if you keep something up in a warm, moist space for 6 to 8 hours a day, sometimes women would even keep them up in there for longer, and I've known women that have lost tampons in their bodies, and they have basically mortified in there. The tampon, the gauze has been up in there for a while, and this is the honest to God. And this kind of mortified up in the body. So it causes toxic shock in the body because it's all of these parasites, all of this bacteria, all of this waste is sitting there, and it's contained. It's contained in this area. So then it's able to do just like a parasite coming out of the intestines. It's able to get out and to travel. So I think that's where the toxic shock come out. So I don't think too much about tampons.
It's just they sell so much stuff to women.
Oh, yes. It's all about the almighty dollar. It's not about helping us. If it was about helping us, we would be different. Okay, good example, why Christians get sick. We talk about why Christians get sick. Christians talk about, well, you shouldn't do drugs, you shouldn't do heroin, you shouldn't do cocaine, you shouldn't smoke cigarettes, you shouldn't drink alcohol. But then that same Christian will go get prednisone. He'll go get all of the different drugs, the Vasotec for the high blood pressure. He'll take Prozac for the nervous system. They'll go and get all of these other different drugs. So what's the difference? So it's just, 6 in one hand, half a dozen in the other.
So for women and female reproductive health, the main things are support.
The main things are to support the organs by taking different herbs internally, and also by learning how to do herbal douches, to learn how to use vaginal suppositories, and also to use rectal implants, all based out of herbs. Okay. All based out of herbs. I'm Dr. Beverly Nicholson, and this has been the Make the Herbal Connection. Today we've talked about women's health issues, and if you'd like to learn more about herbal douches and any of the things we've talked about, women's health issues, give me a call in the office at 773-568-2344. That's 773-568-2344.